session for today. So, all the participants, very warm welcome to today's webinar from the APPNA Merit. So, this time we are so lucky. We have so much different, really. So, this could be the secret sauce of this webinar. Sometime we have the topic, we have the people who are really phenomenal, so different. So we are so excited to listen to Dr. Hesham A.K. Ibrahim. So I will introduce Dr. Hesham. He is an emergency medicine consultant and clinical educator at Hampshire Hospitals, UK, with specialist interests in emergency cardiology, ultrasound applications in emergency care, and medical education, including fellowship OA medicine, a graduate of An Shams University, Egypt. He holds the Egyptian Fellowship of Emergency Medicine, the European Board Examination in Emergency Medicine, and is both a member and fellow of the Royal College of Emergency Medicine by examination. He served as an examiner, sir, for Royal College of Emergency Medicine, leads cardiology and the medical training initiative within his department, and is an instructor with the European Resuscitation Council UK, Egyptian Resuscitation Council, Royal College of Surgeons, and the UK Society of Acute Medicine. As founder and course director of the Emergency Physician ECG course and From Zero to Hero in ECG program, he is widely recognized as a regular speaker at national and international emergency medicine conferences. So the introduction is so interesting, like, you know, more than a medical doctor, like a stage person, like a celebrity, it is so fun to introduce such type of personality. So we very warm welcome you, Dr. Hasham. So the theme for today is that in the beginning, we will have some question to know more about Dr. Hasham and his journey, which is very, very interesting. So that uh, part will be 15 to 20 minutes. So this is going to be an open discussion to know more so that we are ready to listen to his second thing, which is the how to present a powerful talk. So I think in that he will giving the really what he learned and what is the way forward. And the third part is then more participative from your question answer session. So there are so many degrees in his credit. I am not sure that I have covered all of them. Maybe he can, if anything is missing, he can add, please, because being a little naive to understand so many things, it's a long, long list and ever growing. And he looks so young, which is amazing, really. So, with this, we open the session and welcome to the participant from around the globe. Depends on, Assalamu alaikum, good afternoon, good evening, good morning if you're from West Coast. So, thank you very much, all of you, for joining. So, let's start formally. So the over to Dr. Hasham to share the important steps of his journey, how, step by step he developed these interests, what are the significance, what was the driving force, what is so important in that, and how he grew laterally upward and, in all direction. So over to you, Dr. Hasham.
Thank you so much for this lovely introduction, and I'm really honored and happy to be with you here today. I really hope that I deserve such an intro. So thank you so much. No, I think you've covered all what I've done. You didn't miss anything. Thank you. And yeah, so I'm Hisham. I'm an emergency medicine consultant. I currently live and work in United Kingdom. Um, I think The journey started back home in Egypt. I wasn't initially trained in the UK. I started in Egypt. I've had my high school, my medical education in Egypt. Then I got graduated there, and I practiced emergency medicine for 5 years in Egypt before coming to the UK. I completed the Egyptian Board of Emergency Medicine there, then decided to come to UK. It wasn't planned initially, it just happened for different reasons. I decided to come to just get more exposure and to get more exams done and to get kind of a different experience. And the plan was to come to UK, get some exams done, and then go back to Egypt. Uh, but this happened in 2012, and I'm still here. I've done the exams. I've done the fellowship exams of the Royal College. I've done the European Board exam of emergency medicine in Germany, and I'm still here, still learning. It's a really exciting journey. I think this is one of the things that's unique about emergency medicine. You're never done with education. The more you go, the more you learn. And yeah, here I am. So this was the beginning of the journey. In
Super.
terms of
So you,
yeah,
sorry, go ahead. Yes, please.
in terms of what made me change the direction after finishing my training in Egypt and to come here, it was kind of a mixture of kind of attractive things from the UK. It was mainly the medical education. I wasn't really satisfied about the emergency medicine training I've had in Egypt. The emergency medicine as a specialty, and I believe it's quite similar to the situation in Pakistan. That's why I'm referring to this. It's Egypt was the second country in the world after America to have the emergency medicine as a specialty in the 70s of the previous century, but it was only in one university. It wasn't a national thing. It became a national thing, I think, 2002, 2003, and I joined the emergency medicine training in 2005. So it was, sorry, in 2007. So it was still a very, very young speciality. I didn't know what emergency medicine was. I was interested in medicine. I thought I'm just going to be an acute physician somehow. I liked cardiology. But the problem was I couldn't apply for a postgraduate certification in cardiology while I was in Egypt because I had to wait for 2 years post graduation to do this, and I didn't want to wait. So emergency medicine was available as an option. I didn't know what this is, but it sounded exciting, sounded cool. So I thought, fine, let's just give it a go and see how it goes. And I ended up doing it. And if I go backwards in time, I think I will choose the same. It looks like emergency medicine chose me rather than me choosing it, but it was the right fit. I can't do anything other than emergency medicine now.
It's very interesting to know. Generally, they see the stress level in emergency medicine is very high. They measure the stress scale of physician or the healthcare service provider. In emergency medicine, if you compare it with dermatology, you understand the eye, the stress level is phenomenally very high. And most of the surgical specialty, the stress level is high. So few people they thrive on stress. So it looks like you have a personality that you like it. It's the exciting adventure, even you go the high ride sometimes. So there's a lot of adrenaline rush, and few people they enjoy the adrenaline rush. But moving to your different interest areas, as I mentioned in the introduction, so those specific areas like your hero to zero and zero to hero in ECG and few any other thing, it's a very diversified. So you feel that rather than having a laser focus approach in one thing and expanding your canvas to include more and more, it is more exciting based on your personality. So what was the best click between your personality and your choice of the topics?
Great question. I think reflecting on this, it was a mixture of things. My main interest is medical education. I like teaching. I like explaining things to others. And that came from kind of a it can you can see it as a selfish thing. I do not understand things till I teach them. So whenever I teach something, Albert Einstein said it that way. If you cannot explain it to a 6-year-old, then you don't really understand it well. So this is how I started my interest in education. I was teaching my friends anything that I do not understand so I can understand it better. Then that moved forward when I was doing emergency medicine, that I ended up finding that my job in the shop floor, besides seeing patient, is teaching all the time. I'm always either teaching a patient, teaching a relative, teaching my nurse, teaching my colleague. This is what we do every day without calling it teaching, but it is teaching. So developing that kind of passion about teaching was the drive force behind this. I found ECG as kind of the blind spot for emergency physicians. It's one of those things that it's always kind of taken as guaranteed. You're a clinician, you must know how to read an ECG. But if you look backwards about what sort of ECG training we've all had since medical school, there is nothing formal about it, especially if you're looking at it from the emergency medicine point of view. And I found that this is one of the commonest investigations that we do on daily basis in ED. So if I'm not good in it, then that's a failure for me as a clinician. Plus, I worked when I was a junior doctor in Egypt in a hospital that was kind of labeled as a trauma center, but it was built nearby a massive population area. So there were all the surgical specialties in the hospital were there, but there was no medical specialties. And I ended up seeing, plus the accidents that were brought to me because that's a trauma center, I ended up seeing all the medical patients, and I was the only doctor there to look after them. Most of them were cardiology cases, so I ended up being the cardiologist to be able to serve them. And that even fueled more my passion about it. So I ended up teaching ECGs, and hence this bit came like that. Then I moved to UK, and then I found that to be a good emergency cardiologist, I needed to know a bit more about echo. So I started learning echo, and that helped me to kind of cover all the gaps in my care that I provide to my patients, and I ended up loving the focus from this point of view. So it's all kind of needs based. I needed these skills to be able to be a good clinician, so I started learning them. This is how things moved. But this is kind of yeah, how to cover things. This is the thing about emergency medicine. You can't be an emergency physician without having some sort of a diverse, broad spectrum of skills. Otherwise, you won't survive.
Super. So you have a deep interest, in these cutting edge technologies like the ultrasound, the ECG. How do you see the artificial intelligence is going to boost the progress, support the doctor in decision support, and where the artificial intelligence is at this point in time, and what do you see in the coming 3 to 5 years where it would be and how it is going to affect the result, the diagnosis, support? So because you have a very good knowledge of the technologies as well, so you are the right person to ask this question.
I see this as a scary question, and I'm one of the few in my department who is, I'm not going to say against, but I would say very concerned about the involvement of AI, especially when it comes to ECG interpretation. And the reason for that is, first thing is when you get an AI to interpret an ECG for you, the AI will interpret based upon what the ECG is showing. But ECG interpretation, to do it correctly, you need to link it to the story of the patient, to your clinical assessment. You cannot really interpret the ECGs in isolation. AI will do this in isolation, and that can cause misleading results. My other concern, and that is my biggest concern, is I don't know if we have cardiologists in the group or not, but there is always some sort of a sensitive relationship between emergency medicine and cardiology and the ED physicians and the cardiologists. And over the past few years, because I'm the cardiology lead in my department, I invested a lot of time and effort to improve this relationship, and it's now really working well. They trust our assessment. When we ring them with a finding, they don't double check it. They're happy with what we say, and they take it from there. When we rely on the AI, two things will happen. First, we will be de-skilled because it will be easier just to get the AI to do the job for you. And when it comes to ECG interpretation, I don't think we can afford being de-skilled. That will be really tricky. And second thing is we will lose the trust. I am afraid that one day I will ring the cardiologist to say, I can see in the ECG 1, 2, 3, and they will say, what did the AI say? I don't want this day to happen. I want the cardiologist to listen to me, not to the AI interpretation. It's great if I can use it as a helpful tool, but it cannot replace the human interpretation of it. So this is my concern regarding AI interpretation, in particular with ECG. When it comes to the AI interpretation of the ultrasound images or radiology report or radiology images, that's different. That is more reliable because it's kind of the human anatomy. You can feed the AI with the different human anatomy patterns and they can come up with more accurate things. But ECG is very unique and it's very different. You can have the same ECG in two different clinical scenarios and the interpretation can be very different. That's my concern.
Brilliant. So, also there are other tools like they are putting the AI into the new generation digital stethoscope in cardiology, and it's trained, say, on millions of the data and backward integration. Do you have any opinion, experience, or viewpoint about those tools other than these tools?
No, I'll be honest with you, I haven't really used any of these. I got involved with the AI with ECG interpretation, but not with the stethoscope AI applications. That's new to me.
Yeah, because that's trained on the heart rhythm, that's trained on the heart sound magnification, and vis-a-vis the as a human being sometimes we are fatigued and trained on millions of the data. The exposure dimension is huge, and the logic and the confidence, it also varies because the technologies are evolving, and I don't know where is going to be the main point of intersection when they are going to be used, because these are all experimental and their clinical validation, their regulatory validation is not there. So we are growing. So I think we have so much to learn from you, from your personal journey. Now you can start your formal presentation. We are really excited. So you can start your PowerPoint presentation.
Okay, let me share my screen. Okay, I hope that you can see my screen now as a full screen.
Yes, 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 perfect.
Excellent. Okay, so let's just quickly go through a quick 10 minutes presentation about how to be on the stage, how to own the room, how to be on the spotlight. The reason for me to focus on this one is I've been speaking in national and international conferences for long, and I was quite surprised to recently find a study that talked about being on the stage and the fear of being of public speaking. It was found in a survey the second fear after the fear of death, and that was really scary for me to hear. And I get scared being on the stage, and yeah, no matter how many times I get on the stage, it's still a scary experience. But I learn a lot by being on the spotlight, and I enjoy this in a way. So I thought I'm just going to share some of the challenges and how this actually developed over the years with me. So let's start with going back in time. Let me take you in a journey back in time to 2007. So in 2007, I was graduated from Ain Shams University. I finished my foundation years, and I started my emergency medicine training. Back in that time, I was a young, excited boy. I was super keen on the emergency medicine as a specialty. The vision in my head was I'll be moving from saving a life to saving another life. It will be exciting. I will just smash it, and that would be the dream job for me. I was passionate about learning the science of emergency medicine, so my thought process was just give me the textbook. Back in that time, textbooks were the go-to place. Where is the textbook that I can just read? And if I read it and master it, then I can say confidently that no matter what comes through this door of emergency department in the next 5 minutes, I will just smash it. Nothing is going to be scary for me. It was a point of a complete lack of insight. But anyway, few months down the line, and I was this miserable boy. I suddenly discovered a lot about emergency medicine and about myself that I didn't know about. First, I discovered that I have a very short attention span. I cannot focus for long. And it's not, by the way, just my problem. It looks like emergency medicine attract those people with short attention span, or it makes us with a short attention span. I'm not sure which is which, but this is what we have. I also found that I am by nature someone who would take the time to learn. Give me the book, give me the time, I will study it and I will be good with it, but I need some time. Problem is, I took the fast pace of the work environment with me at home. So I found that I struggled to focus at home because my eyes are just running across the lines with the same pace that I had in the hospital. And that was exhausting. I also found that I cannot really stay up to date with all the changes that happens in the guidelines on daily basis. That was really hard for me. And I struggled mainly with the retention of information. So what I did was I attended many talks and many lectures and many courses trying to learn. And interestingly, I noticed that I retain some information more than others depending upon the talk that I attend. So some talks will I will retain them better than others. So I started focusing on this and I tried to find out why there is a difference between this talk and that talk in the knowledge retention. And that was the beginning of a really interesting educational journey for me. So let's get you guys to do some work. If you want to scan this QR code with your mobile phones, this question will appear on your screen. And I'd like you to answer it for me, please. If you're attending a talk and you think, which of the two do you think is more important for the successful one? Do you think it is the speaker or the topic? Which one plays a better, the major role? So scan the QR code and let's answer the question together. So someone answered, so let's see. Okay, we're getting there. I'm gonna release the answer once just few more of you answers. Here we go, let's see. So speaker or the topic, both are important, but if you're gonna choose, which one will you go for? Okay, let's see. 100% agree with you guys. It is the speaker. So let me give you some tips about how to turn a dry talk into a powerful one if you are the speaker for this talk. I would always start with relevance. So give me the best speaker in the world to talk to me about the new approach for draining subdural hematomas in theaters, and I'm not going to be interested and I'm not going to retain anything out of it because it's irrelevant to me. I do not do this and I will never do it and I will never need it. So relevance is gone. So to me, relevance is a key. So whenever I've never given a talk, and I've given hundreds, I've never given a talk to any audience that I didn't know at least a bit about them. I need to pitch it at the right level to the right audience to make it relevant to them. I can talk to medical students about acute coronary syndrome, and I can talk to emergency medicine consultants about acute coronary syndrome. The talk will be very different because I need to make it relevant to the audience. So that is the first key. Make sure that you know your audience so you can pitch your talk at the right level. With the coming generations and with the loads of distractions that we have, I found that we all struggle with our attention span, as I said, especially with emergency physicians. It's really hard to make a conversation with an emergency physician for over 30 seconds. 30 seconds and you will lose the eye contact and everyone's going to be thinking in a different place. So I think you've got 10 to 30 seconds in the beginning of each talk to grab the attention of the audience. If you do it in your first 30 seconds, you're going to keep them for you. If you lose them in your first 30 seconds, you're done. They're not going to come back. You've lost them and there is no going back with that. It will be really hard to bring them back. So try to make your first 30 seconds as attractive as possible in any talk you give. And the best way to get people to listen to you in your first 30 seconds is to promise them with a good story. So I hope that my story about me starting my journey in my medical education managed to work as a good hook for you to join this talk and to keep you awake with me. Using personal stories is always a great way to attract audience engagement. The reason for that is stories, by definition, is attached to emotions. They bring emotions. And whenever you can attach a learning outcome to an emotion, it burns in the memory and it will stay for life. So this is the way to ensure that your audience will keep the information that you give them. If you make them laugh, they will remember that you've done this and they will remember why. If you make them cry, it will be the same. So bring strong emotions to your teaching and you will be brilliant. And the other thing is the engagement. So one of the most powerful things is to use your body language. That is easy when it is a face-to-face teaching. When it is virtual, it's really challenging. Same with eye contact. Your eyes is the most powerful tool in your teaching if you're doing face-to-face teaching. And use your voice. With virtual teaching, unfortunately, all what I have is my voice, my face, maybe my shoulders, but this is all what I have to use. So it's totally dependent on the voice. Make sure you're not monotonous. Make sure that you go up and down. If you're giving a story, make sure that your voice reflects the emotions in the story. This is how to catch the attention of your audience and not to lose them. And lastly, use technology to improve engagement. So when it comes to technology in this situation, we've just used one of them, and the word gamification is going to come. So gamification is a relatively new term. It entered the medical education just recently. I think 2010 was the first time it was mentioned in the medical education. And it's basically turning medical education into a game. When you play, that will first bring positive emotions. Second, it will make you use more than one sense. You're not just hearing, you're talking, you're using your body, you're using your emotions, you're investing all your emotions and your body into the game. That means that you've got all sorts of receiving ways in your body to get the information from the game. So if the game was designed well to deliver a clear message and a clear learning outcome, then that will be the best way to improve the retention. So gamification will improve the engagement with the education process and it will improve the retention of information. And there are so many different ways to develop gamification in your workplace. I mean, I'll be honest with you, Jabin is an expert when it comes to this, so I'm not gonna talk about this in her presence. But VR in simulation training, simulation in general is some sort of a gamification and depends upon how high the fidelity of the simulation is. It's entirely up to you. But by all means, the more interesting the game, the more immersive the game is, the better the engagement of your audience will be. So these are some of the tools that I use in my teaching. I personally use Slido, but they are all the same. They work really well with virtual teaching. They work with face-to-face teaching. You can use them in so many different ways to create some mini games like what we've done when we were scanning the QR code to answer the question. It eliminates the fear of answering in front of others because the answers were anonymized. So if you're not scared to share your answer, you will share it. Some of us are very embarrassed to talk out loud, so that is the best way to get them to engage without that fear or this embarrassment. And it also will get you to move more muscles rather than just sitting and listening. No, actually, you're going to use your hands, you're going to use your brain differently, and that will improve your engagement with the teacher. So yeah, so this was just a quick talk about different tools that you can use to improve your presentation skills. So we've talked about the different tips to present a talk that sticks. We've talked about the gamification as the name of the game, and especially with introducing the AI, you've got unlimited options. You just need to use your imagination about how to design the right game that brings the best learning outcome. Because today this talk is quite a short one. So what I did was I expanded on this talk and I've created it that is available for you to access via this QR code. So if you want to scan this QR code, it will get me your email address and it will get you this talk. And I can share that talk with you and I can share some other educational things as well with you. And these are my contacts for anyone who's interested. And yeah, basically, this was it about my presentation. Those are some of my grandparents, just to let you
Thank
know.
you so much, Hisham. Sorry, I was not able to join at 11 because of few things. So thanks for your presentation. Any comment by you, Dr. Uzair, before I would
Yes,
like to
we,
ask
yeah. So
Hisham some question answers about his journey,
yes.
because I thought for our audience it will be very good to know how Hisham started his journey as emergency medicine, and from various cultures, how he come from his own country to UK. So that's what was intent, to inspire the young medical students, young physician, to follow the same pathway. So Dr. Zair, over to you.
Yes, so the first thing is you touched at the very right time. So we were into the gamification, and Hasham mentioned about the use of virtual reality and how
Mhm.
to engage the participant and how to convey the message fully. So
Mhm.
you can share your experience about the use of these latest tools for the medical education, and the simulation and all those things, and then you can also ask the right engagement from Hasham about your experience as his experience, and how they are moving forward. So can you share something about your experience and the impact of this simulation?
Yeah.
I have attended your lecture, so I know it very well, but for the participant it's very important.
Yeah, thank you, Dr. Zaid. I think me and Hisham has been working now almost for 2 years together. And what we have found that, yes, gamification appears a little bit daunting, that how we will do a game and then make it reason where people will learn something about medicine. But these Gen Zs, we have to think about how we are making a difference in various educational pedagogy. So what we have found, for example, I think I have shared my experience with Hisham as well, that escape rooms and making small puzzles, like the younger generation become very, very intrigued by it. So, for example, donning and doffing PPE, doing simple tasks like how much fluid is needed for DKA. So, all these things we are using gamification, and we are finding a very good results with them.
So, Hasham, you were sharing your journey, and you mentioned about many important things, the concentration span and your journey in terms of learning. So, do you feel that in the career, the most important thing is a best fit? You understand your personality. So, when selecting your career, so you should thoroughly know about your personality, your liking, and your learning style. You mentioned about how you learn your eye movement. So, do you feel that, uh, as a what we call it, the educational psychologist, there are many ways to learn. Some people who are very strong in auditory learning, few people they are so smart in visual learning, so they learn better by showing the pictures and the auditory. So if they see an accident, you ask two people to share their experience. If they are visual learner, they start sharing, I saw this thing, a blue car with red car striking, hitting, all thing color and visual. And another person, maybe sharing his experience, there was a loud voice, boom, and I saw, there was something going on. Do you feel that the analysis of the personality is very important when selecting or entering into a career? Because if it's a perfect fit, the chances of growth and the chances of interest, control over job, and engagement with the job, like you mentioned about, your initial days, how important it is. And do, because, all developing countries, whether it is Egypt or Pakistan or South Asia or Middle East, most of the medical graduate, they never know that this is their personality trait or not. So that's why you feel them that they are leaving the field, they are exploring the other field. When they started this thing, they had no clue really where they're going to end. And later on, they realized that no, this is not the place I was looking for. And they are neither satisfied here nor satisfied there. Then they start missing what they had, because many of my class fellows, they switch their career from the medical doctor to the other administrative position, sitting in writing the competition exam, and they are neither satisfied over there nor satisfied over here. So as a contemporary practitioner of medical education, so do you feel that the perfect fit can be achieved by knowing the personality traits, the learning behavior, and then, betting on the career? Or what's your feel and, observation and advice?
So, this is a great question. It's got so many to unfold. Let's start with, I 100% agree, totally agree. The your personality will fit or will not fit with the specialty you choose. And the problem is we choose, as you said, we're very poor identifying our strengths and weaknesses in the beginning of our journey. So I didn't know myself when I was a medical student. I didn't know my strengths, my weaknesses. I didn't know what it takes to be an emergency physician, what it takes to be a surgeon, what it takes to be a physician. So the problem is nobody explained that to me, and I didn't know that I have to know this before making my choice for a career that I might go for with it for the rest of my life. So that takes different parts. Part of it is on me as a junior doctor starting my career. I need to understand this, and if I don't know, then I need to ask. I need to ask myself, what do I enjoy doing? Do I enjoy looking at all the details of things? That's more of a physician mentality. Am I more of a doer with my hands and I don't really care about details? I'm just doing things. That's more of an emergency medicine slash surgical mentality. It makes a big difference. You cannot be with a surgeon mentality and to do medical. You will struggle because you will miss loads of details. Same if you go with your medical mentality to do surgery, you will be too slow. They
Yes.
are very analytical with the medical minds versus the surgical minds. So you need to identify this bit. Then we move on to identifying how you study, how you learn. So as you've correctly mentioned regarding the learning and teaching psychology, you need to understand what type of learner you are. And that takes me to the mentors. So me as an educationalist, one of my jobs is to spot with my trainees how they'd like to learn, how they prefer learning, and then I adapt to the situation. It takes time, it takes a personal contact to get that done. I cannot do this on a virtual setting with people that I don't know. But at least with my trainees, this is one of my duties that I remind myself of, that I need to keep an eye on them and advise them regarding their career if I feel that they're not the right fit for what they want to do from the personality point of view. And I also need, when I teach them, to teach them the way that I know that they will enjoy more, rather than the way that I will enjoy more. It's not about just delivering, it's about reaching the outcome. The outcome is not giving the talk, the outcome is getting the talk well received and retained. And there's a big difference between the two.
Yeah,
So that
that
would be you.
took us very much pivot. We want to do it at the beginning of the presentation, but just because was late, why don't we do it? Hisham, as far as I know, as a person, as an educationist, as an emergency physician, you're very inspiring, and your journey span from Egypt to UK. So I just want to ask you that what moment or mentor first nudged you toward emergency medicine, and then especially towards education? Was it a planned pathway or something that folded along the way?
It was, so we've touched on this in the beginning. I didn't know what emergency medicine was
Mhm.
in Egypt because it was introduced to Egypt as a national training program in 2002, and I started my training 2007. So when I joined just because it sounded cool. It sounded like, oh, I'm gonna be just saving lives, and that is great on its own. And so I didn't have an example in my head about what emergency physician should be, except from the ER series. And George Clooney was not really a good reflection, or a true reflection of an emergency physician, let's say it that way. And so I didn't have anything to relate to. But on starting my journey, I've had so many mentors and role models on my way. I was very lucky that every job I've worked in, there was someone to take my hand and to guide me through from this end to that end. So many struggles that I would have had without these mentors. So I'm very grateful to every single person who helped me across the journey, because it was a tough one, and I've been helped a lot.
I think what I'm hearing from you, Hisham, having mentors, talking to people who has that kind of journey is so important, and I can relate so much from you. I want to become a pediatric hematologist and oncologist, and I was waiting for the admission. And then when I work in the emergency medicine just as a transaction job, and I realized that I like it the always acute care, and that's how I get into emergency medicine, so I can relate. So, Hisham, I saw a lot of your contribution on a network called FOAMMED. Can you tell a little bit about it? What inspired you to be part of that network? Can you share with our attendees what it is about and what knowledge and what information they can gain from that network?
Great. So FORMID is a great blessing. I would say it that way. We were just talking about having mentors, and the problem with having mentors in my time when I was a trainee was the fact that I'll need to be geographically attached to my mentor to learn from them. With the fact that with the globalization that is happening now, with the presence of the internet, with the presence of the YouTube, I can have mentors from across the globe now. My current mentors, I learn a lot from Amal Matu in the States. I learn from Scott Weingart. I learn from Stephen Smith. I've got mentors everywhere. I can just follow them in their social media. I can follow the free medical education, and then I learn from them. So that was the spark for me to be interested in FOMED and that sort of medical education. Part of the answer to your question is, why am I doing this? Well, this is how I learned. I've learned from the others, and I see it as it's my duty to transfer this. In every religion, in every culture, you should pass the knowledge that you have. So to me, it's a no-brainer. This is my duty to pass it on. So that's part of it. But if I'm going to think about it from a selfish point of view as well, I was saying in the beginning, I learn when I teach. When I explain things, I understand them better. So that would help me to understand things better. And in the same time, this was said to me by one of my mentors in Egypt years ago. He said to me, "I'm teaching you how to do CPR well, so you do it well on me
Mhm.
when I need it."
Need
So
it.
I am teaching those who will treat me and treat my family. So I need to teach them well because they'll be my clinician one day, and I don't want to regret that I didn't teach them.
Very nice. I always think about that because we all will require one day to go to the healthcare. And I think about the same thing, that whether do I want to be treated by that physician. So when we or our families need the most. Hisham, I shared the FOMED website. Just have a look. Is it a correct website, or if you want to share the one for everyone who is here? But meanwhile, while maybe you can do it later, but I know that you lead one of the most popular ECG courses in the region. What gap do you see in the ECG education? What pushes you to start your own epic like EPEC website? Can you tell us about it? I know it's called Zero to Hero in ECG. Can you share the story, how you started, and you share with the learner and listeners that how they can access and take advantage of from those courses?
Definitely, yes. Thank you for the question. So, the gap that I found was a personal gap. So, I started my emergency medicine training and I discovered all of a sudden that I'm supposed to make decisions based upon ECGs on daily basis without really having any training on them. So, ECG is one of those things that are, oh, you're a doctor, you must be able to interpret an ECG. But if we go back in time, how many formal ECG training I've had in my career? Zero. So, that was my first problem. My second problem when I tried to find courses about this where I couldn't find anything that is tailored to the emergency physicians. Nothing from the emergency physician's eyes, all from the cardiology perspective, but nothing from our perspective. So that was another struggle. I get patients all the time who are unconscious or confused and they've got an abnormal ECG and I've got no history. How do I deal with this? This is a problem that doesn't exist for cardiologists. They see filtered ECGs reviewed by someone else. There is a provisional diagnosis. There is a story behind it. We excluded the non-cardiac causes, and now we're talking about the cardiac ones, and let's have a chat. That is very different from my cohort of patients. So that's the other problem. The third problem was all ECG training I could find was through books, and books do not, they teach more theory rather than they give me the clinical nuggets. I'm more of a clinician. Yeah, it's good to know that the P wave is coming from the atrial depolarization, but I've got a patient now with an ECG that shows an abnormal P wave. What do I do for this? What does this mean to me now in this clinical context? I couldn't find this anywhere. So what I did was I just kept collecting ECGs with their stories across the journey. I've got ECGs that are about 20 years old now. And I ended up putting them together. I found that there is a course developed. So this course started 2016 in the UK, and it's been given almost 40 something times now since then in over 20 different countries. And it's been doing really well. So it was a problem that I found myself, and I was helping myself by developing it. And I think you've shared the link, which is the correct link.
Yeah, yes, I have shared with you for you all the link of APPNA MERIT. I have shared the YouTube channel link as well as FOMED link and Zero to Hero link, courses link. And I can tell you, I have been part of, like I haven't attended the whole course, but I have been part of it. And the way Hisham explained, the way he take it is amazing. And those who have not attended and want to learn more about ECG, I would highly recommend them to attend. And also, Hisham, you do annual conferences as well. And as far as you, I know you don't charge for them. It is free for anyone to access. Can you tell them about? And these are all virtual conferences, I think for half day or full day, and anyone will be able to submit their abstract and present their research project as well. Hisham, can you elaborate it a little bit for me?
Yeah, sure. So in terms of free medical education, I provide on my social media almost daily medical education. So on the YouTube, on Facebook, on LinkedIn, I share cases and I discuss them almost on daily basis. I've got on my YouTube channel about 160 something video there now, all in English. So I've started recently another Arabic channel as well, but the focus is on the English one. So that's all available to everyone. On my website, I started providing free online modules. So I do a webinar almost every 2-3 months that is available for free for everyone. And when it comes to the conferences, so I've been running and chairing an international virtual conference for the last 4 years now. The conference is completely for free. It is in July every year. And I offer as well free abstract submission. So we've just finished our July one, and what I do is I record the conference after it's over, and I edit the video professionally, and I make it available for people to join it later as well if they want to revisit. If they missed the conference, they can get the certificate by watching the videos and get the certificate at the end. That's all automated. That is all for free, whether to attend or to watch the recording or to submit your abstract and get a certificate of abstract if it is successful. I've got a really strong scientific committee that looks after the abstract review, and yeah, they do a great job. So next one is going to be in July. I will release the date soon, and I will release the joining link very soon.
Perfect. And we are very happy if Dr. Uzair will agree that we are happy to share and promote in our APPNA Merit network
Yes.
so that more and more people can join. One thing that one of our attendee has asked in the chat that we all know that the gamification and fidelity is very important concepts in the today's era, but they are costly as well. For example, AR, VR, for especially for the low resource settings or low income countries. So, do you have any suggestions that how those countries can implement these things?
Yes. So what I personally do is because I was teaching in Egypt before coming here, and Egypt is not different from Pakistan. So when it comes to the engagement technique, the engagement tools, you don't really. So Slido is not that expensive, and if you're using a university account, you get a massive discount on it. And I'm talking about Slido because this is what I personally use. So you can use this in your teaching. But more importantly, it's the story, it's the speaker, it is the instructor, not the mannequin. No matter how high fidelity the mannequin is, if the speaker is poor, if the instructor is poor, is not good enough, they will fail. The learning outcome will not be achieved. I used in Egypt to get one of the candidates to lie on the chair, and then we are going to come up with a scenario, and then I will give the story. The story is what's going to attract people, not the fidelity. We've got mannequins here in the UK that can cough, that can sneeze, that their pupils will react. We can do all sorts of things. But with a poor simulation, it's not going to be helpful. It's going to be a toy, not an educational tool.
And I completely echo. And gamification does not mean like we have make tabletop gamifications, like you have board games. People have developed board games. I was in an education showcase last week, and they have like the Ludo game or their Monopoly game. Similarly, they have created a sepsis game. So gamification is not always using a high technology, high tech stuff. Gamification again is a methodology. Me and Hisham will agree with me that we always say simulation is a technique. Yes, a lot of technology come into play, but it's not about technology, it's a technique and how you will use technique. For example, one of my team member was telling that how they have done gamification, that they put a lock box and then they have a puzzle when for how to don and doff, what are the steps of don and doff, and there were pictures of don and doffing. When they put in the right sequence and when they turn it, they get a code, and that is the code to unlock that box which has other information. So this is very much doable by your simply available stuff which you use it. I would say you as an educator have go back to your childhood. You have to see what games you used to play and then where and how it can be used now in your education. So, Dr.
So,
Zaid,
Dr.
I
Jabin,
know I
yeah,
joined late, so I could not see Q&A
no, no, no
section.
problem.
Uh,
So,
can
yeah,
you
yeah,
please
I
tell us
sure,
if there's any Q&A in the Q&A
yes,
section?
yes,
Yeah.
sure, sure. Thank you, Jabin. So, the first question is, I don't know how relevant it is, but it is about somebody. How can I get post graduation in disaster emergency management?
Okay.
I am from Pakistan. So I think Hasham is from UK and Jabin, you are from Toronto, both of you. So it is up to you. So if you have anything to respond to this question.
So from my side, I am not aware about a formal way of doing this. The problem is to get something like this, you will need to have the right to work in the UK. And to get the right to work, unless you're doing it from the academic side of things, and that is different. So there are fellowships that you can apply for, and some of them will have fun. So I think the Royal College of Emergency Medicine offer some sponsorship for some of the programs for in developing countries to support things like this, but that will be just on the theory side of it. If you're planning to practice in the UK, then you'll have you'll need to get the GMC number, you'll need to have the right to work. And this is a complicated process that involves the PLAB testing and the English testing to be able to get to start the journey and then to take it from there. So yeah, that's about the UK side.
I agree. Here also, there are two pathways. You can come either through the pathway, as Hisham said, right to work, where you have to complete the initial exam, do residency, and the other pathway, if you have complete the specialized exams in your own country, for example, FCPS from Pakistan, then you can apply for fellowships. But most of these fellowships for international medical graduates are non-Royal College accredited, but it will give you an experience, and it's mostly to learn and then go back, as we have these 1 year fellowships, which we call it clinical fellowships. So I think you can connect with Hisham, you can connect with the WhatsApp APPNA group, and then we will be able to provide you more details about it, because I think this time period will not be enough to tell you the years of journey, that how we get into the system and how we get the training. But a great question, and continue to reach out to us. There's a question here, and this would be the last question because we are almost 3 minutes away only. What would be you advise an emergency registrar in crowded trauma center do to become exceptionally composed under maximum stress, and also to stay present and be able to draw on the detail in your knowledge in those situations? Any drill or things to focus on? I think the question is, in such a chaotic and busy emergency medicine, how can you be a good clinician as well as a good educator? How can we find that balance, basically?
So I think the answer to this is going to be a common sense, but I will share here something that I've learned coming to UK that I didn't used to do in Egypt, and I didn't pay much attention to it, and I believe that the Pakistani friends will share that with me. In Egypt, I didn't used to have breaks when at work. Breaks were not a thing. You have a break when there is time, and there is always no time, so no breaks. Sleep is an optional thing. That is something that happens when you get a moment, but it's not a guaranteed thing. And this was the way things happen. It was not like there is a structure for something like this. Then I came to UK and I started working the same way. And then all of a sudden, I was blamed by my consultant for not having my break. And I was like, I'm showing you that I'm a hard worker. I don't need a break. I'm carrying on. And I was told off for this. And then I started learning the hard way that breaks are not for you. Breaks are for your patients. So if you don't have a break, that means that you will make mistakes. And that means that your patient is going to come to harm. So having regular breaks, planned if possible, within the team, ensuring that you eat well during the day, during your shift, and you sleep well before your shift and after your shift, and to have enough break time between the shifts. There are European rules for this that we follow in our rota. All these things I didn't know about coming to UK. In Egypt, the shift starts when I get into the department, and I'll be honest with you, I would have my cloth bag going into the hospital, not knowing what to tell my wife about my return time. I will return when I'm done. That can be tomorrow, that can be the day after. I have no idea. That doesn't happen in the UK.
Yeah, so the whole concept of physician wellness, you have to always remember, anywhere in any algorithm, your safety first. So I would say Hisham is telling the same thing, that we cannot be working as a continuity, as a machine, and expect ourselves to be perfect. But yes, it is a fine balance that we have to find. Any last comments, Dr. Uzair? And there's a lot of people are asking how they can access recording. Waleed, can you please share the YouTube channel one more time, the link of the YouTube channel? Thank you so much. Dr. Zaid, any last minute comment before we will sign off?
So I think this was one of the most engaging session, I must say, very interactive. And Dr. Hasham knows the art of communication.
Yes.
When I go back to my undergrad level, so there was a complete disconnect between the art of communication and the medical knowledge. So We had the wonderful people who know their subject inside out, but how to communicate that effectively, that is another science. So these are two different things. So I learned a lot, and relevance. So that's the key message out of this thing. So how relevant everything is. So it's a great learning. And the bottom line of this session is you carry some message that remain in your memory forever. So that is the beauty of any interaction, essence of any interaction. It was really fantastic, and I'm grateful for Dr. Hasham's time and for our participant to spare time to join, ask question and interact. And you can now formally say thank you to Dr. Hasham and we can close it, please.
Yeah, thank you so much, Hisham. It's always inspiring to hear, and I apologize for being late. But you carried the session very well. For all the listeners and learners, there are always many, many resources, and I would highly encourage attending conferences and webinars done by Hisham, and we will share on our website as well. And Hisham, there's a lot of good comments and learnings people are sharing in the chat. So I really, really thank you from the APPNA MERIT platform for your presence here, as well as Dr. Uzair to the being the backbone or foundation of this important network, and definitely Waleed, who always provide us the background. Like he's an unsung hero, I would always say, because he managed all the technological part of it, and I would really appreciate his participation. Thank you so much, everyone. Dr. Uzair,